Welcome to the Technical Assistance Network for Children Behavioral Health, Cultural and Linguistic Competence Peer Learning Exchange. The Peer Learning Exchange is a webinar or monthly call with topics focusing on culture, health equity, and disparities in children behavioral health. Topics are generated by you, individuals working in or being served by behavioral health organizations and partnering with systems of care, states, and communities. The PA network, as it is known, is the National Training and Technical Assistance Center for Children Behavioral Health for the Substance Abuse and Mental Health Service Administration, SAMHSA. Today's webinar is part 2 of a 4-part series on implementing the CLAS standards. Today's webinar will focus on language assistance using interpreters. On July 13, we will host a webinar on recruiting and hiring a diverse workforce. We will conclude with our series on August 3rd with a webinar in cultural and linguistic competent leadership development. My name is Miriam Monsalve Serna. I am the president of the Center for Community Learning in Miami, Florida. As a partner in the PA network, the Center for Community Learning provides technical assistance in the area of cultural and linguistic competence. Our expertise focuses around issues of language assistance, CLAS standard implementation, community capacity building, diversity and equity training, behavioral health literacy, and reducing behavioral health disparities. Today's discussion will be led by Catalina Booth and Angelina Giovanni. Angelina Giovanni is the owner and founder of Full Circle Interpreting, a minority-owned interpreting and translation company based in Durham, North Carolina. Angelina is a certified court interpreter, and she has over 15 years of experience interpreting and translating in the private and nonprofit sectors in North Carolina. Prior to starting her own company, she was a community organizing for the North Carolina Latino Coalition, where she consulting as Latino Ombudsman for the Department of Social Services in Durham County, with the goal of improving the delivery of bilingual and bicultural services to the growing Latino community. Ms. Giovanni was also the executive director of El Centro Hispano, where she oversaw programs to foster leadership development and resolve community problems through service provision, education, and community organizing. Catalina Booth is the executive director of the Center for Community Learning. In her role as a member of the PA network, she has focused her work on CLAS standards implementation. She has designed materials to educate administrators, practitioners, and consumers regarding the history and purpose of the CLAS standards. She has also conducted training on culture and cultural identity and how to implement the CLAS standards. In addition, she has authored and co-authored briefs and CA tools designed to help system of care organizations understand and implement the CLAS standards at the organizational level. This presentation is being recorded. Your lines will be mute right now to help eliminate the background noise. So feel free to use the chat box to type in any questions or comments during the presentation. Following our brief presentation, we open the line for further questions and discussion. So, without further ado, let's get started.
Thank you, and thank you everyone for joining us. For those of you who have joined us in our previous webinars, welcome back. And for those who this is their first CLAS standard implementation webinar, welcome. We hope that these webinars will be in your practice and in your organization. Today we have 3 learning objectives. The first one is to review the CLAS standards that deal with language assistance. The Second objective is we want to learn and apply practical tips to working with interpreters. And finally, we want to gain an understanding of the role of culture in communication and interpretation. We're going to begin with a brief review of the CLAS standards for those that are not familiar with them or who just need a refresher. One tool that we have available to us to provide equitable and effective behavioral health care is the CLAS standards. The national standards for culturally and linguistically appropriate services are a set of 15 action steps intended to advance health equity, improve quality, and help eliminate healthcare disparities by providing a blueprint for individuals and healthcare organizations to implement culturally and linguistically appropriate services. The principal CLAS standard is the guiding principle or the mission statement of the CLAS standards, and it states that the goal of the CLAS standards and the goal of behavioral healthcare organizations should be to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. Today, we're going to focus on the CLAS standards dealing with language assistance and communication needs. These four CLAS standards 5 through 8, are different from the remainder of the CLAS standards in this way. CLAS standards 5 through 8 are mandates that stem from Title VI of the Civil Rights Act of 1964, which prohibits discrimination based on national origin. And then in 2000, the President, through its executive order, declared that people with limited English proficiency should have meaningful access to all federally funded programs and activities. And thus, CLAS standards 5 through 8 are what we commonly refer to as regulations or requirements. They are required of anyone who receives federally funded programs and activities. The remainder of the CLAS standards are guiding principles, so they do differ legally slightly. And we'll dive into just these CLAS standards that deal with language assistance. And they are CLAS standards 5 through 8. CLAS standards 5 requires organizations that receive federal funds to offer language assistance to anyone who has limited proficiency and or communication needs at no cost. The next CLAS standard dealing with language assistance requires that organizations inform all individuals of the availability of language assistance. Number 7, organizations are required to make sure that the individuals providing language assistance are competent. They give further guidance that the use of untrained individuals or minors as interpreters should be avoided. And the last CLAS standard is that dealing with language assistance is that organizations are required to provide easy to understand used by the population in the service area. And we covered all of these CLAS standards in our last webinar, and particularly CLAS standards 6 through 8 as we discussed language assistance plan. So today's focus is going to be on providing language assistance through interpreters and in how to make sure that they are competent. So with that, we will start our next section. I'll turn it over to Angelina, who will talk about how to work with interpreters. Angelina, you might need to unmute your phone.
Yes, got it. Well, thank you, Catalina, and good afternoon to everybody. It's a pleasure to be with everybody today. So today we're going to be talking about the different modes of interpreting. There are 4 different types of interpreting that are used, or better said, language assistance. These are done to basically provide services to LEP individuals to make sure that they have full access to all the services and programs that you offer. So the first one is consecutive interpreting. This may be the one that people are most familiar with, and that is where basically the interpreter will first listen to a unit of speech in the source language, and then they will convey that same message into the target language. So the length of the passage can vary, but usually it's about 40 to 60 words at a time. So the provider, let's say, would speak, then pause. The interpreter would render this message into the target language, and so forth, back and forth. So that would be consecutive interpreting. The other mode of language assistance is known as simultaneous interpreting. Sometimes that's also called conference interpreting. So that's where you would use the equipment. So basically, folks would wear a headset, and the interpreter would speak into a small mic, similar to what you're seeing there in the picture, and basically interpret at the same time. So the interpreter is lagging a little bit behind the source language speaker, but they're interpreting the message into the target language at almost the same time as the original message is being said. So this can be really useful in certain settings, for example, workshops or conferences, places in which you don't also want to take twice as long because, as you know, with consecutive interpreting, it will take about twice as long to do whatever you need to do because one person needs to speak and then the other one. So simultaneous interpreting certainly has a lot of great applications in the work that we do. Another thing that's not listed here, but I hear many interpreters talk about, is what they call sometimes whisper interpreting. So perhaps it's similar to simultaneous, but without the equipment. So sometimes the interpreter will be next to the person they're interpreting for and sort of whisper into their ear at the same time as they're interpreting. So that's another sort of form of interpreting as well. But it's basically simultaneous interpreting, but without the equipment is what they're doing. So the third mode of language assistance is sight translation. And sight translation is basically when you take a document that is in written form, and then the interpreter will read that entire document and then interpret that document orally, from the written form orally into the target language. So that would be sight translation. And then finally, translation is just basically the rendering from one language into another, but in written form. So I think that's a common sort of misuse of the terms. Often people interchange interpreting and translator, but interpreting is oral and translation is in written form. So I think understanding the different modes of language assistance is really useful because then it can help you choose the right type of language assistance that you may need for a particular case and also the right person for that job as well. Because it's very important to also note that you could have a wonderful simultaneous interpreter and they perhaps do not have the skill set to also be a translator, and obviously vice versa. Even between consecutive and simultaneous, it takes a very different skill set to be a good consecutive interpreter versus simultaneous interpreting. So the fact that you may have a wonderful consecutive interpreter doesn't mean they're great at simultaneous and vice versa. So ideally you would look for individuals that have a broad array of these skills, but it's important to not assume that that is going to be the case and that they're going to have all of these skill sets, but to make sure and that they do have what you need for that particular case. Next, I wanted to show you this concept of looking at language assistance as a continuum. So there are very different ways in which we can provide language assistance to folks. So on one end, you have a bilingual provider. So in that respect, you would have someone that can perform their duties entirely in 2 or perhaps even more languages. So this could be perhaps a bilingual nurse or social worker or therapist. Well, the great advantage of this, of having a bilingual professional, is that they can communicate directly with the LEP individuals, and that entirely breaks down the language barrier during that interaction. So in a sense, obviously, you're not using an interpreter. You're just solving the barrier of language access by having a bilingual professional in that role. So that is one option in terms of just hiring these bilingual professionals. But we know and we understand that that is not sometimes possible, and you're not able to hire somebody for these positions. So that's why then we have the assistance of interpreters. So one option in terms of providing interpreting services that we see a lot in agencies is staff members that have two different roles within the agency. So perhaps it could be a bilingual receptionist that is also occasionally used as an interpreter. We're going to talk a little bit more in the next couple of slides about this option, so I'm going to leave it at that for now. And I'm going to go to the next one, which is, so apart from having the staff members that have these two roles, you could just hire a staff interpreter. So this would be a full-time person or perhaps a part-time person, but somebody that is exclusively hired within the agency to provide interpreting services. And the other option that one can have is perhaps you don't have a need for a full-time person exclusively interpreting, you can hire out contract interpreters. So obviously this is done by companies in your area that provide these services, and you only hire this person to come in during that assignment. So during that workshop or client interview or whatever session, whatever you may be doing. And then finally, on this other right side of the spectrum, you have the assistance of language lines. So the great thing about language lines, obviously, is that they normally have a lot of different languages. So nowadays, we see such a great diversity of folks coming from different places, and language lines tend to have access to a lot of different languages. Obviously, the negative side is that they are over the phone, although nowadays, they're doing a lot through video as well. So they're doing a lot of video interpreting, which has a lot of advantages over exclusively doing the phone, because at least you can see the interpreter can see you guys, because there's so much that happens, right, in terms of facial expressions and body language that is really important to be able to capture. So at least with the video that they're coming up with now, it's a little bit better than just exclusively over the phone. So I just wanted to show you there's different options, right, of language assistance, of when you're thinking about your agency and how we can solve this language barrier, what are some of the different options available to us? I would dare say that I think the options towards the left are perhaps a little bit more advisable, because obviously, again, a bilingual provider, well, you eliminate the barrier completely, and the language lines can be a little bit more impersonal and harder to capture some of the nuances of speech and cultural considerations, et cetera, that may be happening in an interaction. So I wanted to share that with you. Let's now speak a little bit about these dual role folks, so changing hats, the folks that you may have in your agency that serve both as interpreter and as staff members. So some questions that I think that are important to consider when choosing to use a bilingual staff member as an interpreter are, well, first of all, is interpreting in the person's job description. So sometimes what happens is that this person is hired, like I mentioned before, perhaps a receptionist, and they were never really told that they were going to be interpreting. Maybe you never even thought that they were going to be interpreting, but the need sort of came up, so then you ended up pulling this person from their job to then go and interpret. So I think it's important then to make sure that if that person is interpreting, that is something that is actually part of what's expected of them, right? So it's part of their job description. When you're hiring for them, you take that into consideration. So that way you can actually hire somebody that you know is going to be qualified for that part of the job that they're going to be doing. Another thing to consider is the person a competent interpreter or simply bilingual? So sometimes, we hire great staff members for whatever job they might be doing, and they happen to be bilingual, and they're perfectly capable of doing their job in Spanish or whatever other language it may be, but they don't necessarily know how to interpret at all. So, it's really important, and we can never assume that because a person is bilingual, they have the necessary knowledge and tools to be able to interpret. So that's important to clarify, and if not, well, then to make sure that this person is properly trained for it, which is the next point. Is that staff member trained and then evaluated on their duties? So I've seen this in a lot of agencies as well. Because it sort of just started happening, then the person never got properly trained for it in terms of these duties as interpreter, and they're never evaluated on it either. So perhaps they have a yearly review where they evaluate that person's regular sort of job or primary job, let's say, but they never evaluate the interpreting aspect of it. So that's really important as well. So if you have, again, one of these folks that are doing these two different jobs, make sure you're also evaluating that component of their job, the interpreting. And then the last point is, does the individual separate the two roles of provider versus interpreter? So when a person is perhaps, a bilingual nurse, and then sometimes they're used as interpreters, well, when they go perform their duty as interpreter, it's really important that they're just interpreting at that moment. So they're not giving their own advice, and because perhaps they know how to do that job, they end up sort of trying to take over and do the job directly, with the participant. No, it is very important that if they have these two roles, okay, right now I'm doing this job as a therapist, but right now I'm just going to help out and interpret in this other setting. And it's important for the participant to know that that is happening and to clarify that at that moment. Another couple of things that are perhaps not mentioned here in this slide, but are good to keep in mind is be conscious of how much time the interpreting is actually taking of this person's day, because perhaps without even noticing, this person's actually spending 75% of their day interpreting, and you really had hired them for something else, and perhaps they're neglecting their primary duties because everybody keeps pulling them in different directions. So always be conscious and aware of that type of situation. And then also think about, is it cost effective, or does it make sense to be using this person to interpret? So, for example, I have seen cases in which you have a caseworker, perhaps in social services, that is bilingual, and they end up going in to interpret for another caseworker. So really, this is a job that they can perform directly themselves. They are trained to be a bilingual caseworker. So does that really make sense for them to go and spend half their day interpreting for another caseworker at their same job? So these are all sort of things to consider and keep in mind as you make these decisions when you have folks that are doing these two roles. I'm now going to speak a little bit about the role of the interpreter. So we're going to explore the different roles the interpreter can have, from the most basic role of a conduit to the role of advocate. As you see in this image, the largest segment in the bottom is of the conduit, because as you will see in the next slide, this is what the interpreter really spends most of their time doing. And as you get up into the pyramid or triangle, the role of advocate, that is the least amount of time that an interpreter should spend doing is advocating. So as I mentioned, the main role of the interpreter, as the most basic and fundamental role, is for them to be a conduit. That means they are rendering a message from one language literally into the other. They're not adding anything. They're not taking anything out. They're not putting in their own opinion. They're not making it sound nicer. They're not taking out any cuss words. No, they are saying exactly what you're saying from one language to the other. And like it says here, that's like the default role of the interpreter. So when you're using, for example, contract interpreters, this is what they're going to be doing. And what most interpreters are going to be doing is just being a conduit. And another thing to keep in mind is that when you're using an interpreter, you can evaluate whether this is really happening or not, whether they're really saying everything that you said, or whether they're taking things out or adding things. Although you do have to take into account that in other languages, things can perhaps take a bit longer to say. So, for example, in Spanish, it takes a little bit longer, both in written form and in oral form, to express that same message. However, you can tell, well, she's going a little bit too long. Or maybe you said a long segment, and the interpreter only spoke very briefly. So, as a provider, it's really important for you to be listening in and sort of getting that feeling, right, of whether that message is going through entirely and the interpreter is not taking or adding things away. For this, it's also very useful to watch out, like for the facial expressions. So if you're saying a certain thing to the participant, you can see by their facial expression or body language to make sure that that corresponds to what you're talking to them about. And if there's some kind of discrepancy, it's an opportunity to go ahead and clarify. So the other role that the interpreter might have is that of clarifier. And this role can be taken if it's necessary to facilitate the understanding. So perhaps the interpreter will adjust the register. The register just means sort of how formal you're being or informal. The interpreter could explain or make some pictures to perhaps be able to communicate something that has no equivalent in their language. And the interpreter sort of checking for understanding to make sure the person's really understanding what is being said. In my case, for example, as a professional contract interpreter that just goes into an agency for a particular meeting for an hour or so, I rarely do this. I rarely do the role of clarifier, if at all. For example, in the court system, you can't do it to begin with. I mean, you cannot change the register at all. So if the judge is speaking at a certain level or the lawyers, you have to do it in the same way. You wish you could clarify and make it simpler for them, but that's not your role as an interpreter to do in most of these settings. In most of the cases, really, it is the responsibility of the provider, of the person speaking, right, the doctor, the lawyer, the social worker, to communicate in such a way that he or she is understood, and to check and make sure that the participant really is understanding everything clearly. So therefore, ideally, the provider should be checking with the participant, make sure this is the case, because ideally this responsibility should not rest on the interpreter, but on the provider in terms of clarifying. However, working as a team, the interpreter could clarify something for the participant, but in this case, the provider should be informed that this is happening. So the interpreter should not really take it upon himself to be doing this, but should be really doing it in conjunction with the provider. Another role that sometimes the interpreter can have is that of cultural broker. So this applies when cultural differences are leading to some kind of misunderstanding on the part of either the provider or the participant. The interpreter would then provide necessary cultural context in order to understand the message being interpreted. So, for example, if the interpreter notices that due to some kind of cultural difference, something is not being understood at all, or it's being misinterpreted, then the interpreter, perhaps the best thing to do is to pause and say something to the effect of, the interpreter thinks the participant may need some clarification in regards to these instructions. And then the provider, perhaps with the help of the interpreter, who can provide some cultural context, can explain things to the participant in a different way. However, when you do that, something that's really important is that when you're having these side conversations, so if the interpreter is sort of conferring and talking to the provider, it is really important to let the participant know that that is happening, to tell the participant, listen, we're just trying to think of a better way to explain this, just give us a moment. That way you're not leaving them completely out of the conversation. Obviously the same would be true, if the interpreter is having a conversation with the patient or participant. It's really important that if they're clarifying something, to let the provider know as well, because in any of these situations, you don't want to leave any of the parties completely out of the loop and out of the conversation. And then this final role of interpreter, and as you remember from the triangle, is something that the really interpreter does like the least at all from all these different roles, is this role of advocate. So advocacy is an action that an interpreter takes on behalf of the participant outside of the regular interpreting. An advocate is maybe concerned about the quality of care, something that may be happening that they need to speak out about. So, for example, an on-site interpreter would become an advocate if he sees that the participants are not being cared for the right way, like there's some kind of systematic problem or barrier that's affecting folks. So really the best example of this is, let's say that there's going to be some type of harm that's going to happen to a patient. So let's say that there's a patient that has a life-threatening allergy. and for some reason the doctors overlooked this allergy. Well, obviously the interpreter would be perfectly fine to advocate for that patient and to make sure that this allergy is known in order to avoid any harm happening to that patient. Another example is the interpreter may advocate for a group of people to correct some kind of abuse or mistreatment. So if an interpreter is continuously seeing some type of pattern of disrespect towards patients, the interpreter may speak to his or her supervisor about this and just let it be known that this is happening. So there are some instances in which the role of the interpreter as an advocate is appropriate. Now we're going to shift gears a little bit and speak about some tips in terms of just using an interpreter, how to sort of the before, during, and after of when you work with an interpreter. So first would be the pre-session. So that would be anything that you have to do beforehand, before the actual encounter occurs. So first you would provide the interpreter with any relevant background information, any materials. So really it does improve the quality of the interpreting services quite significantly if the interpreter knows what they're walking into. I mean, often we don't have that luxury and we just need to walk into a space and do the best that we can. But any kind of background and context that you can provide, even if it's just a 1-minute conversation before you walk in there as to what you're going to be doing, what it's going to be about, is very, very, very helpful for the interpreter. The second point is to make sure that you schedule enough time. So maybe you're used to doing these, whatever you may be doing in an hour. Well, it's going to take longer than an hour if you're going to be interpreting, particularly obviously with consecutive interpreting. So that needs to be scheduled. So make sure you have enough time for that whole encounter to happen like it needs to. Number 3, have all the materials available in the language that the participant speaks. So if the person is going to be signing any kind of consent form, or they're going to be coming up with some kind of plan, at the end of the meeting, you perhaps come with different bullet points of things that the participant is not going to be doing, or really any kind of handout, brochure, anything that you have that you're going to be using during that meeting. It's really important that it also be in the language of the participant. And finally, make sure that you do have a physical space for the interpreter. So whether they need a space at the table or whether it's going to be a chair to the side. It just really obviously depends on the kind of interpreting you're doing. Even if it's a workshop and you're doing simultaneous interpreting, obviously you need a table to the side where the interpreters can sit. So whatever type of interpreting you may be doing, just check with the interpreter in terms of what kind of space they might need to make that work. So next is to talk a little bit about what happens during the actual session. So the first thing to do is to, obviously, the interpreter would introduce him or herself and to clarify to both parties that everything said is going to be interpreted. I find this to be even more important when you have folks, again, that are doing those 2 different roles of interpreter and staff member, because maybe that person is very familiar with the participant, they know each other, so it's really important to start, the interpreter by saying something to the effect of, oh, hey, listen, Maria, I just want you to know that although I work with you a lot with those community education classes that we do, at this moment, I'm going to be exclusively interpreting for you. Everything that we say here is going to be confidential, and everything that you say, I will have to repeat, and vice versa. So just to clarify again that everything said will be interpreted to begin with. And next, it's also important, especially if this is the first time that folks are using interpreters, the interpreter should really instruct people to speak directly to each other. So I think what ends up happening a lot of times is that folks, both the participant and the provider, end up looking at the interpreter. And ideally, that should not be happening as much. I mean, obviously, you can't help her perhaps here and there, but what needs to be happening is that the folks that are trying to communicate with each other, participant and provider, need to be looking directly at each other. And that's the 4th point here speaks about that, like, so physically set up the room in such a way that can happen, that they can look at each other directly. So really the interpreter perhaps is more to the side or in the middle, kind of like away from them, so that basically the chairs are facing each other in terms of the folks that you want looking at each other. So, and that goes to the third point as well, that they need to speak in first person. So they just look at them directly and speak as if they spoke the same language. You speak in first person. So you do not say something to the effect of, oh, can you ask him when he went to the doctor last? No, you say, when did he go to the doctor last? So that's important as well in terms of clarifying that you speak in first person and directly to them.
And let me add something. This is Catalina, because I have a personal example from here. I'm bilingual, and oftentimes when I worked as a prosecutor, I would do informal interpretation for prosecutors who had Spanish-speaking witnesses. And I happened to have a case where it was my case. I was in trial, so there was a court-appointed interpreter, and they were translating everything the witness said. But my brain understood the Spanish, and I went ahead and asked the next question because I understood the answer without waiting for the interpreter, and went ahead and asked the next question even without thinking, and I asked it in Spanish, and the judge looks at me and he goes, can you try English, and can you try waiting for the interpreter? So sometimes if you have, one thing I would recommend, if you know that the person you're interpreting for has some language skills or some knowledge of the language, remind them that they still need to wait until you finish, because my brain did not compute either of those two, and I made a mess of it. So.
That is a great point. Thank you, Catalina. So the next thing would be just a briefing after the session. So just, after you use an interpreter, it's always just good to check in and say, hey, how did it go? Was that fine? Because you could always learn something from each other in terms of how to make that encounter better the next time, right? Because this is all a learning process. So the important thing is just to continue to learn and find new ways of doing things. So perhaps after we can clarify any misunderstanding, provide background for what's going to happen next, and just maybe, for example, the famous acronyms, that's a big thing that happens in a lot of meetings, for like child and family team meetings called CFT and the IEP and all these acronyms, perhaps too many were used, and well, the interpreter just used the same acronym and the parent had no idea what was said. Perhaps they were speaking too fast, or their segments were too long. So, you may be going on as a provider and you're happy to sort of go on for a couple of minutes. Well, that's obviously going to affect how effective the interpreter is going to be, because as good as somebody's memory could be, it's going to be really difficult to be able to memorize and be able to relay such a large chunk of information. So just touching a base afterwards, just to see what can be improved, would be really important. Now let's talk a little bit, well, this is just to summarize sort of what we've been talking about in terms of that the most important thing is that relationship between the service provider and the participant. Really, the interpreter, is just a means for that relationship to be able to develop. So that's the most important thing to keep in mind. Sometimes the interpreter can overstep their boundaries, and it's important for that not to happen. I mean, I have to bite my tongue almost every time that I go out and interpret. I mean, I always want to say something more. I always have a great idea for that person, of how they can solve all their problems. I mean, I always have something I've done a lot of work besides interpreting, right? So maybe that happens with the interpreter that you're getting as well. Maybe they're professionals in that field as well, and they have all these great ideas. It's fine to share all those ideas, but not at that moment when you're interpreting. That can happen before, that can happen after, but it can't happen during the session if you're going to be really a professional interpreter. So it's really important for the interpreter to not overstep their boundaries in this way, and to really empower that provider to be able to do the job that they need to do, and for you to just be a conduit. So that's the important thing about that, because sometimes you can have a knowledgeable interpreter and they can just presume to do the whole job themselves, and sometimes even the provider. I mean, I've seen social workers where we've gone out on a home visit, and perhaps I've done this with them a lot of times, and they just sort of hand me over the form, and they're like, okay, can you go ahead and complete the form with them? Well, that's not how they would normally do it, right? With an English speaker, they would ask the questions directly. So I have to sort of remind them, well, my role is really just to communicate whatever you want to say to them. Please, just do it as you would normally do this home visit, and then we do it. We take it from there, because sometimes, again, it could be either the social worker trying to sort of give these jobs to the interpreter that are not really their job to do, or it can be the interpreter wanting to take over the job of the provider. So that's really important to keep clear. The most important relationship is between the provider and the participant, and again, we are just a conduit. So I wanted to share with you this tool that you may be familiar with. For a long time, there wasn't a certification process at a national level for interpreters, in this case, in the medical profession. And finally, this came about, and there's a code of ethics and this national standards of practice that interpreters can follow. And then these entities can also certify interpreters as well, which is really wonderful, because then you have folks that have gone, through some basic training and have, this very basic level of understanding of this ethical code and of the practice of interpreting. So these national standards are designed to help improve the quality and the consistency of interpreting in healthcare. So it's similar to perhaps clinical protocols for physicians. These standards are going to provide a guidance as to what is expected of healthcare interpreters and what constitutes good practice. And I find that, again, even if you're not working strictly sort of in a traditional healthcare setting, these are very practical for folks. So if you have interpreters that are working with you already, and maybe they haven't gone through any training, they can go through the process of getting certified with them. Their materials are available online, and you can have access to them. We're not going to go into all of these, but I just wanted to show it to you because these are some of the areas that are covered in the standards. So they talk about accuracy, confidentiality in terms of the interpreter being confidential, the impartiality of the interpreter, respect, cultural awareness, advocacy, well, all of these areas here. So these are available online, and you can read through them, or again, share them with somebody perhaps in your staff that may need to have access to them. And I also wanted to share some resources with you guys over here in terms of places where you can go to find qualified translators or interpreters. So this first one is the American Translator Association, ATA, and there's a list of certified translators for written documents there. And many states have their own associations as well. So here in the Carolinas, we have CATI, for example, and I'm sure in different states you have other options like this. The next two are these agencies that certify medical interpreters and have these standards for medical interpreters. Obviously, you can also look for legally certified interpreters in your state. So there are interpreters that get certified either statewide or federally. And a lot of communities have local interpreting programs. So over here, for example, our community college system has an interpreter program, and that's another place where you can go and have access to some interpreters. They have to complete community hours, for example. So if you have a sort of, basic interpreting needs, they could fill that need. Then you have community-based organizations, so refugee resettlement programs, where you may have access to some language assistance through them. And then there's a lot of sort of online training programs that you can have access to for folks that you may be hiring to interpret as well. Well, with this concludes my portion of the training. It was really a pleasure to be with you today, and I wish you the best of luck in this ongoing process of providing the best quality care to all of our participants. And Catalina, I'm going to hand it over to you now.
Thank you. And in this last segment, we're going to briefly talk about the role of culture in interpretation. And as Angelina mentioned, one of the standards of practice for an interpreter is cultural awareness. And why do interpreters need that cultural awareness? Why is culture such an important part of what we do? Well, the reason, in his 1970 book entitled Language, Edward Sapir wrote that culture and communication are inseparable because culture not only dictates who talks to whom about what and how the conversation proceeds, but it also determines how people encode messages, the meanings they have for messages, and the conditions and circumstances under which various messages may or may not be sent, noticed, or interrupted. Therefore, one can say that culture is the foundation of communication, and they are inseparable. And the CLAS standards reflect that. The principal CLAS standards clearly state that we need to be responsive to diverse cultural health beliefs, preferred languages, and other communication needs. So as part of those communication needs is the understanding of how culture affects language and communication. So the role that we have in the system of care goes beyond merely providing simple translation to understanding how culture affects the way people communicate. Why are culture and communication so closely tied together? Why is it important to consider culture? The reason is that only 7% of personal communication is composed of spoken words. The rest is determined by voice, tone, and body language. These components are heavily influenced and defined by cultural norms. Word choice, language, personal space, use of silence, gestures, eye contact, posture, informal or informal register, tone of voice, all of these things are also culturally defined or culturally influenced. And understanding something about the culture the person comes from will help us decode these messages. And sometimes we need to use the interpreter to help us decode those messages. And that's how Angelina talked about that. Sometimes the interpreter becomes a cultural broker and advocate. While it is not their primary function, there are times when we need to be aware of these cultural differences so that we can truly understand and serve our clients. The goal is for interpreters to serve as a bridge, and in order for them to be an effective bridge, interpreters need to know more than language. As their standards of practice said, cultural awareness is an important part of what they need to know. When interpreters take culture into consideration, they can bridge any gaps between the cultures of the provider and the consumer. And I'm going to read to you an interpreter's own story of how they effectively use their cultural knowledge to bridge gaps beyond language differences. And this interpreter writes, "This incident happened when I was interpreting for an Iraqi Muslim woman wearing a hijab, the traditional scarf worn by Muslim women to cover the hair, neck, and sometimes the face. We were at an imaging center because the woman needed x-rays of her neck. We went into the x-ray room where we met 3 technicians, a man and 2 women. Everything seemed fine at first, but when one of the female technicians asked me to tell the patient to take off her hijab for the x-rays, I could sense a problem brewing. When I interpreted the message for the woman, she became restless, confused, and embarrassed. At this point, I stepped out of my usual role as a language conduit to act as a cultural educator. I told the technician that the patient felt uncomfortable with the request to remove the hijab because doing so would be in opposition to her cultural beliefs. I explained that because of certain customs and religious practices in her culture and Arabic culture, some veiled women find it very difficult to expose their head to members of the opposite sex that are not related to them. I then pointed out that both the male technician and I were unrelated strangers to the woman. Upon hearing my explanation and seeing the woman's discomfort, the male technician left the room swiftly. However, this did not solve the problem, so I had to come up with a solution. I told the patient that I was going to interpret with my head facing the wall. Doing so would give the woman personal privacy and help maintain her modesty, and at the same time, the technicians would be able to do their job comfortably and efficiently. A great sense of comfort appeared on the woman's face. Likewise, the technicians were pleased by my suggestion. Because they were now sensitive to the patient's cultural and religious needs, the technicians were able to do their job without subjecting the woman to further psychological distress. It was a win-win situation for everyone. The joy that I felt when I left the building was indescribable because I knew that I had done the right thing. My solution had enabled 2 parties who did not share the same cultural beliefs and medical practices to understand each other better, and it helped the technician provide medical service in the most respectful, altruistic, and caring manner." So it's in this way that interpreters help bridge the gap by understanding language, but also having understanding of cultural practices and health beliefs that are influenced by culture. As we wind down, I just wanted some points to reflect on. Interpreters can and will help you provide effective, equitable, understandable, and respectful services that are responsive to diverse cultural practices, preferred languages, and other communication needs. Without proper cultural knowledge and training in the field, behavioral health interpreters run the risk of ignoring, misinterpreting, or mishandling situations that arise. When you hire a capable, well-trained interpreter, you help bridge that gap, and you help provide equitable, understandable, and respectful services. Therefore, it's important for you to remember Angelina's advice and retaining qualified and trained interpreters, and ones that have a good awareness of cultural differences and have cultural knowledge of the culture they're interpreting for. Remember, you want interpreters that can be conduits, clarifiers, and when needed, and in those rare situations, can also be cultural brokers and advocates. And as one last remaining point, it's a video that we watched in our last CLAS standards webinar, where a particular organization, a particular provider, felt that the person receiving services didn't need an interpreter because she spoke Spanish pretty well. But what the patient explained, what the participant explained, is that she's not able to really express her feelings in English, and that she prefers to talk about personal matters in Spanish. So keep in mind when you determine whether or not you're going to use interpreters that different people have communication needs rather than just direct, I don't understand the language at all, but maybe when they're bilingual, they have different needs according to their experience speaking that language. That's just something else to keep in mind, and remember that it's not just about translating words, but also helping people being able to communicate effectively. One thing I wanted to point out before we open for questions is that right below the public chat, there's files available for download, and there's one called CLAS Language Assistance Part 2. If you click on that, you'll be able to download a PDF of today's slides so that you can print out and use the resources that Angelina provided, and you can have our full contact information. With that, I believe that Gary is going to unmute the line. And so if anybody has questions, keep in mind that the lines are unmuted now, so if you are talking with someone or this conversation is unmuted,
yo lo cierro menos porque hay tanta cosa en la pantalla que me desespero.
Y ahora voy a...
So if anyone has questions or comments, since we do have some background noise, if anyone has questions or comments, we're going to wait a minute, and you can type those in the chat. So if there's any comments, or if you have experiences and best practices that you'd like to share, please feel free to use the chat. And we'll give you guys a minute or two to think of questions. And I think
this is Miriam. This is Miriam. I want to mention a little bit how much we are using the cultural broker, because the health beliefs that participants have, and we have to explain to the provider why that health belief is engraved in their way of life. Yeah, if, for instance, in some communities, they use as a way of taking bad luck or bad behaviors, they use what is called a pincer, una limpieza. So we need to explain that to the provider. And lately, we have seen how much we have to inform the providers about different ways that people believe about health and healing.
And that's a very good point. And just for everyone's clarification, and I think hopefully next year we'll offer a webinar specifically on cultural brokers. There are people that all they do is cultural brokers. They have language skills and they could be interpreters, but they're not necessarily formally trained in interpretation. Their focus is simply on being cultural brokers, or some areas call them cultural guides. And their focus is on helping providers and helping organizations work with a particular community that may be either closed or has health beliefs that require some exploring. And so it's not always, and we're not saying that the interpreter should always be the cultural broker, but sometimes you're in a situation where you'll have no choice, like that interpreter with the hijab in the. But there are people who specifically just do that cultural brokerage. Any other questions or comments? Okay, well, the chat box will remain open for a few minutes after we end, but I just want to remind you that we do have another webinar next month. It will be on July 14th. We usually have these on Thursday, but because of other work commitments and schedules and the 4th of July, next month's webinar will be at the same time, 1 p.m. Eastern Standard